evening. I'm Christy Steyer. We begin tonight with new fears over a brand new influenza virus identified in Asia and the Middle East. Health officials say this strain is not related to the 2009 H1N1 pandemic virus and, in fact, appears to be more severe than that strain. Right now, the World Health Organization is keeping the pandemic influenza phase at 3, meaning infections are showing up mostly in animals, but there are a few human infections. The phase level could rise, though, if health officials discover widespread human-to-human transmission in this new virus. Influenza has become a high priority for public health officials all over the world since that 2009 H1N1 pandemic. The Center for Disease Control and Prevention urges everyone to be alert for signs of flu in their community. Even seasonal flu kills 36,000 people every year in the United States. That figure represents between 500 and 700 Alabamians. Now, earlier today, State Health Officer Dr. Don Williamson held a press conference on the newly identified influenza strain. We're going to bring that to you right now in its entirety.
Good afternoon. This is State Health Officer Dr. Don Williamson. This past week, the Centers for Disease Control and Prevention reported a number of possible cases of human-to-human transmission of a novel or new influenza virus in Asia and the Middle East. We understand more about influenza and about influenza pandemics from our experience in the 2009 H1N1 pandemic. However, we do not understand where or why a new influenza virus emerges. With the appearance of a possible new pandemic influenza virus, we need to remember what we learned from the last pandemic. Organizations need to review their continuity of operations plan, and everyone needs to implement infection control measures like hand washing, covering your cough and sneeze to minimize the impact of a new virus before it even reaches the United States. Currently, the new flu virus has not been detected in the United States. However, we in Alabama must make certain we're prepared to respond quickly when it arrives. The department is reviewing plans and preparing our staff to enhance surveillance, ensure the laboratory has the necessary supplies, and protocols to distribute antivirals and supplies are in place, and to ensure that the department is ready to respond. Let's review some of the facts about the influenza disease. The incubation period for flu can range from 1 to 2 days. People will come in contact with it and unknowingly carry it to their family, their work, their community, and other locations. Initial influenza-like symptoms include a fever of 100 degrees or more, cough, and a sore throat. Additional symptoms may include body aches, headaches, extreme fatigue, and some individuals have reported vomiting and diarrhea. If you believe you or someone you know is infected, isolate yourself or the infected individual immediately. Call your primary care provider and see if you're eligible for antivirals. It's a good idea to go ahead and make sure you have certain over-the-counter medications to reduce fever on hand to care for yourself and your loved one. You may also want to consider purchasing surgical masks for your home, car, and office, especially if you are taking care of someone who is ill or if you have a high-risk medical condition in order to try to prevent your own exposure to the virus. It's important to remember to wash your hands. Spend an adequate amount of time rubbing the soap into your hands, at least 20 seconds. If water and soap are not available, use alcohol, hand sanitizers, clean and disinfect all surfaces that can be touched to lessen the risk of spreading disease. Please visit our website at www.adph.org for more updates. We'll continue to inform the public of any and all developments. Thank you.
And again, that was State Health Officer Dr. Don Williamson commenting on the new flu strain. Just to recap some of what he said for you, the novel flu has symptoms similar to the traditional flu. Now remember to practice healthy hygiene. You can wash your hands, use hand sanitizer, clean and disinfect regularly, and consider surgical masks for high-risk family members. Remember, pandemic flu is not the same as seasonal flu. It is a new strain not previously seen in humans. It can easily transmit from person to person, and it can quickly circulate the globe. Flu is transmitted through droplets from coughing and sneezing and through contact with an infected person or surface. Keep all of that in mind. Of course, we here will continue to monitor this developing story and bring you the very latest updates as details emerge.